This is new diagnosis patient teaching for cholecystitis. So, what is cholecystitis? So, it's inflammation of your gallbladder, and what your gallbladder is, it's a pear-shaped organ that's found on the right side of your body below your liver. It works with the liver to create a substance called bile, and it stores and concentrates it. So, bile is a substance that helps you to digest your fats. It's also a vehicle for a substance called bilirubin to exit your body through your stool or your poop. So bilirubin is created by the breakdown of red blood cells, and this gives your poop that orange-brown color because, again, it's excreted through your stool. So who's at risk for this? The female gender is at a higher risk. Obesity, older age, prolonged fasting, a family history of cholecystitis, being pregnant, or a Native or Mexican American ethnicity. So what normally happens with your gallbladder is you eat, food goes into your stomach, and it partially digests your food. The gastric juices that were digested go into the small intestine, and your biliary duct senses the fat. So this causes the gallbladder to contract and release bile through the cystic duct and the common biliary duct, and the bile assists in digesting fats. So when the fat is not digested, it will be released through the stool. And when the ducts are blocked, it's going to keep that backflow of bile, and it's not going to release into the body correctly. So signs and symptoms of this that you might want to look out for or pay attention to are severe nausea and vomiting. If you have any bloating, a fever, frequent gas, you may have itchy skin. You also may have severe abdominal pain, and that will be in your right upper quadrant of your body. And if it goes to be a chronic condition, you want to look out for jaundice, because the bilirubin, if it's not getting through to the stool, it's going to back up and flow into your tissues, and that can cause jaundice. You're going to have something called steatorrhea, which is fatty, greasy stools, because your fat isn't being digested by the bile. You're also going to have clay-colored stool because, again, the bilirubin isn't going to get to your stool, and it causes that orange-brown color. And you also may have dark urine. So treatment for this, usually some drugs that you may be prescribed are antibiotics for any infection, antiemetics for that nausea or vomiting, and analgesics for the severe pain that you may experience. If it gets to the point of surgery, you could undergo an ERCP, which removes gallstones from the common bile duct and allows bile to drain out. And you also could have something called a cholecystectomy if it gets to be too bad, and this is the removal of the gallbladder. It's minimally invasive, so you're not going to be opened up on the table, and this will allow bile to continue to flow by the liver instead of going through the gallbladder. So to prevent this from happening, you want to stay active. You want to try and maintain a healthy weight. Try and eat 3 balanced meals a day. And you want to include foods that are high in fiber and in calcium. And the foods that you want to avoid that could trigger this are fried or fatty foods. And that could also increase your pain. So if you find that you eat greasy, fatty foods and your pain increases, that could be affecting it. You want to avoid eggs, coffee, dairy, and alcohol.